Hi, how do you identify lenses during your ophthalmology practical? Do you look at the thickness or thinness of the lens in center and periphery and try to identify them? Does that hack ever work for you? If it does ever work for you, then how do you identify the cylindrical lenses? So today we are going to deal with identification of convex, concave and cylindrical lenses for your ophthalmology viva. To identify these lenses, you take the lens, hold it at an arm's length and look at a target object through it. Now observe two things, the most obvious being the size of the image. In this case, you can see that the image looks magnified. So this is your first clue to correct identification of the lens. Now move the lens from side to side or from up to down. If the image appears to move in opposite direction of the lens, it's a convex lens or a plus lens. Now why does this happen? A convex lens magnifies the object when it is held close, causing the object to appear larger. And it is used for correction of hypermetropia. Now take this another lens for instance. Again, repeat the same process. Hold it at an arm's length. Look at the target object through it. Here, you will notice that the image appears minified. So you move on to the second step of identification. Move the lens from side to side or from up to down. Here you will notice that the image appears to move with the direction of movement of the lens. Hence, it is a concave lens. Now, take a look through this lens. You can see that the image appears minified. So obviously it is a concave lens. However, when you move the lens from side to side, you can see that there is distortion of the image. Why is that happening? That's because it's a cylindrical concave lens. For a cylindrical lens, the correction is provided in only one meridian. Hence, when you move the lens circumferentially, the image appears to be distorted. Important point to notice here is that the distortion of image changes as the lens is rotated. The maximum distortion occurs in the meridian perpendicular to the axis, and no distortion occurs along the axis. Thus, to conclude, identification of these lenses is not as difficult as it sounds. You just have to look at the size of the image and the movement of the image. And if you suspect it to be a cylindrical lens, move it circumferentially or rotate it and you can identify these lenses. Thank you for watching today's video.